Hello again, everyone. This is Sarah Revels from New Hampshire Center for Cognitive and Behavioral Therapies, here today with one of our master level licensed alcohol and drug use counselors, Dr. George Bortnick. Yes. So just want to introduce you to George. And so George, can you tell us about like your experience at NHC CBT and kind of like what you're excited to be doing here?
Yeah, definitely. I'm proud to be working here since the beginning. We're going on 5 months here, and I've seen a lot of growth in the last 5 months while being here, and I've experienced it myself. Seeing different clients from all different age groups. Primarily one of the things I've really been interested in, and I didn't know this until it was shared, but 50% of our clientele is men.
Yeah.
And it makes me, obviously being a male, something to sort of focus on is what I could offer, what the center could offer, especially pertaining to addiction and co-occurring disorders. When you look at the increase in trauma being identified, whether it's veterans, whether it's, early childhood trauma, which mostly what I see with addiction is people who had some early trauma or war trauma or something like that. And so, having the ability to reach out to not just men, for anybody who deals with it, but in particular, one of the things that I've had experience with is working with men.
Yeah, I know what you mean. It's exciting to think that since we've opened here, you and some of our other staff have been able to do so many things for men and women. So like the LADAC evaluations, right?
Yes.
If those are court ordered, or if people just feel like they need them to help get a sense of what type of treatment they might want. And I know we've been talking about how we're going to be offering some men's groups really soon. And yeah, just that we're working with all ages and being able to do co-occurring work as beyond just the behavioral health and the substance use.
Yeah, absolutely. And some of the things that I've been working on in the past 6 months, I've actually worked with a few high school students who've been struggling with, and primarily their early struggles with substances came from stressing out about tests, stressing out about having to, one gentleman I was working with was taking like 6 AP classes. And so he got involved in substances.
I don't even want to teach 6 AP classes.
I wouldn't I'd be lucky to take one when I was in high school with that. So, experiencing that, what kids are struggling with or what teenagers are struggling with, just to sort of fit in what's available. So it goes beyond, the substances we see on TV or we hear about in the news, which obviously, we work with as well, I work with as well. And a lot of it, like I said earlier, stems from the co-occurring disorder, but also stems from a lot of societal issues which I think from the groups we've talked about, the men's groups or some of the other groups we have going on, would really tap into that because there's a lot you can do individual, but I think with the groups you really get to see how other people, other peers are feeling and interacting, and that you're not alone. I think a lot of times with one-on-one therapy, sometimes you feel that you're the only one who's dealing with it. But when you have the groups, you get to see that you're not the only one and other people have similar experiences.
Yeah, and I think it's really important that we're mentioning like youth, adolescents, teenagers, because one thing that I've learned this year is that in New Hampshire, our youth population, young men and young women, are both really underserved when it comes to like being at risk in a variety of ways, including being at risk for substance use or co-occurring, but just at risk in really any way. And we do a lot. We serve all ages here, of course, but we're able to serve a lot of youth, so that's really exciting. Yeah, and now that we've been around for a few months, you kind of have an office.
Yeah, this is my office. It's nice to have one. Not to be seeing what office is open at the time that I have an appointment. And I've also been involved with a lot of supervision, and seeing where this place not only has gone the last couple of months, but where it's going to go. We've got a lot of exciting things in the pipeline that I'm really excited about.
Yeah, me too.
And the more things that happen, the more I'll be here, which is really great.
Yeah, and thank you. So we're fortunate to have you, George, as an MLADC supervisor, and that's something else that you offer is if there are people in the community like NHC CBT who are trying to promote growth in the profession and they need supervision, that's something that we offer too. Yeah. So Yeah, so that's exciting. So you've got some office space here. People can come see George, come see someone that George is supervising, come be supervised by George.
Yeah,
And and doing evals, doing individual counseling, a little bit of like family stuff too. Families can come.
I've definitely done family stuff,
Mhm.
and obviously we have the pet therapy, which is really great. I'd bring my dog, but he'd be too wild, so I have to get him trained before that would happen.
We can find you a
Uh,
dog litter here.
I'd have to borrow a dog, but
And we share them, and doing yeah, running the groups. So I think for people to be looking on our website for like men's groups and those youth groups, and just having letting women, youth, men, and families know that we're here.
Mhm.
And I think I love that you mentioned that like half of our clientele tends to identify as male because as someone who's worked in outpatient private practice for a long time, I have been stunned by the response we've had from men in the community. It makes me so happy to feel that, the way that we're doing things here is, I think, allowing men to feel very comfortable about connecting and getting evidence-based treatment. And so really proud of that actually. So I like that you brought that up. Thank you.
no problem.
So George, I feel like that's kind of like George in a nutshell. But is there anything else that you think is important to mention, or do you feel like we kind of touched on the main things?
I think we touched on it, but I'd love to meet anybody who wants to come and meet with me, or just wants to come to the center. And we have a lot of great staff, so we have a lot of great choices, and hope to see you.
Great. Well, thank you so much, George, and we'll see you in the next video.
Great, thanks.